Good evening, everyone. This is Lloyd Smucker, Congressman for Pennsylvania's 11th District, which covers Lancaster County and the southern part of York County. I'd like to thank you for joining us this evening on this telephone town hall. It's a special telephone town hall. We have Senator Pat Toomey with us as well, and I'm just really appreciative of his time, and I'm glad that he can be with us this evening as well. Tonight, we will discuss Congress's efforts to combat the coronavirus, and specifically want to talk about Senator Toomey's plan to safely reopen our economy. The Senator will be offering some comments momentarily, and again, I'd like to thank him for joining us this evening. I do want to mention, before we begin, we look forward to hearing your questions and comments for the next 60 minutes. To do so, many of you have been on these calls before, but you simply press 0 on your telephone. You can press 0 on your telephone right now or at any time throughout the call, and you'll be connected with a member of staff who will take your question and put you in a queue. And we'll get to as many questions as we possibly can. So again, and those of you who've been on this know I repeat myself a little in the beginning because many people are still getting on the call as I'm talking. So again, thank you all. This is Congressman Lloyd Smucker. I'd like to welcome you to our telephone town hall. Our focus this evening will be to discuss safely reopening our economy. The data, we want to talk about the data that should drive our decision-making in doing so, and we'll provide an update or take questions in regards to Congress's response to COVID-19. Again, before I go on to my comments, I want to mention those of you who are still joining us, if you have a question or comment at any time, press 0 on your telephone. You can do that right now. I'll begin with a brief status update of where we are in our fight against the coronavirus. You know, at the beginning of the fight, our goal was to slow the spread of disease to ensure that hospital systems were not overwhelmed. And you all now are familiar with the term flattening the curve, ensuring that that peak isn't beyond the capacity of our hospitals to ensure that those who are sick could be cared for. So 2 months later, we have successfully flattened the curve, and we've prevented our hospital systems from becoming overwhelmed. And I'll give you just an example. Of course, this district includes Lancaster and York counties. There are about 6 hospital systems, but one in particular, the largest in Lancaster County, is Lancaster General, affiliated with Penn. On April 7th, they were using a model called the CHIME model developed by Penn, which showed we would need far more beds, ICU beds, intensive care unit beds, for COVID patients than we had available in their system in the county. In fact, the projections were showing that it would peak on May 31st, and we would need 580 ICU beds. And we would need 400 ventilators. That, by the way, was far more, 3 or 4 times more than the capacity that we had in their system. So we were scrambling at that point, all of the elected officials and all of the hospital systems working with PEMA and FEMA, possibly standing up another hospital, the old UPMC hospital, what was St. Joe's, as to provide additional beds. Well, interestingly, we are now almost at that peak, and I meant back on April 7th, I think I mentioned we had 14 ICU beds and 10 ventilators in use at LGH at that time. They were projecting we would go to 580. Today, LGH had 12 COVID patients in ICU beds and 7 on ventilators. 14 and 10, 7 weeks ago. Today, 12 and 7. The peak that we were expecting, that the models were showing, actually never really occurred. There were some little bit of ups and downs, but essentially we didn't just flatten the curve, we crushed it. And at the same time, we have learned more about who the virus targets, and we need to act accordingly. There, of course, is not currently a vaccine or a treatment, although we are making progress every day towards both. So the main tool that we had initially was to slow the spread through the stay-at-home orders and locking down the movement of individuals and stopping that spread. So, but it's been, as I said, successful. But of course, that brings its own risks and has done so. We have seen unemployment rates spike, nearing rates we haven't seen since the Great Depression. 1/3 of Pennsylvania's workforce has applied for unemployment benefits, nearly 2.2 million people, 1/3. We've seen businesses struggling to stay afloat, and in fact, every day we're seeing businesses decide to close for good, and that's despite we did provide unprecedented support from the federal government, but some businesses simply aren't able to withstand a complete shutdown of our economy. So I've been frustrated personally that we aren't open sooner in Lancaster and York counties. We should be allowing any business who can operate safely, who can keep their employees and customers safe, can do that while practicing following CDC guidelines. They should be open and operating now. Been frustrated with the way that the governor has handled the situation. I think has created an additional economic burden beyond that which is necessary, and it's having a significant impact on people's lives. Of course, we've all heard about the waiver process, which is a disaster as well, picking winners and losers, and even recently unexpectedly revoking some waivers without explanation. In terms of where we are in cases, in Lancaster County today, we have now had 4,624 deaths in Pennsylvania, 2,593 cases in Lancaster, 866 in York County. The difference in deaths is far different in the two counties. York, I believe the current number today is 18, tragically. But in Lancaster, it's 271, which is tragic as well. 74% of those cases occurred in nursing homes and skilled nursing facilities. We know now that COVID-19 disproportionately impacts those who are elderly, who have chronic illnesses like hypertension or diabetes or other comorbidities, and those who live in congregate facilities like nursing homes. I've called on the governor for weeks to address nursing homes, and we were finally beginning to do that both at the state level, and recently the federal CDC is sending teams to help with the nursing homes as well. I think I'll stop at that. I have plenty of additional questions, but I would like to introduce our special guest this evening, one of our U.S. senators from Pennsylvania, Senator Pat Toomey. He serves as a member of President Trump's bipartisan congressional reopening group. He serves as chairman of the Health Committee of the Senate Finance Committee. He's been an outstanding leader and a fierce advocate for the people of Pennsylvania. In April, the senator released his own data-driven framework to offer suggestions on how we could begin to safely reopen Pennsylvania. So I'd like to thank Senator Toomey for joining us this evening. And with that, I'll stop briefly. And Senator, if you'd like to offer some remarks.
Sure. Congressman Smucker, first of all, thanks for organizing this. I appreciate this chance to chat with and hear from our mutual constituents. I've enjoyed working with you on pushing to have Pennsylvania's economy safely reopened, and I appreciated your joining me in the roundtable we had last week that included a number of business owners, included representatives from Penn State Hershey, included Lancaster County Commissioner Josh Parsons, and that was very, very helpful. We could talk about the CARES Act, and folks on the call may very well want to discuss that, and I'd be happy to discuss that. I will avoid a long monologue about the CARES Act, but suffice it to say, I think there's three big categories. One is income replacement for individuals who lose their income, have lost it because of the response to the coronavirus. There's a category of how we have been fighting the virus directly, and that's got a number of components that are important. And then there are the business lending and business grant program, grants to small businesses, loans to big businesses, and I'd be happy to discuss that if people would like to. But I just want to go back and just briefly underscore the point that Congressman Smucker was making, which is a really important point, and that is the very clear, specific reason that we shut down our economy, that we took a completely unprecedented and very draconian step. You don't normally put healthy people in quarantine. You normally do that for people who are ill and contagious. But we put our whole state in quarantine, and most states did. We did a lockdown. We said you can't go to work, you can't earn a living, you can't conduct business, you got to stay in your house. That is a very, very draconian step, and we took it because we didn't know enough about the nature of this disease to take the risk, as Congressman Smucker pointed out, that the disease would spread so rapidly and so many people would get sick all at once that we would have this horrific situation in which our hospitals were overrun and very sick people were waiting in a parking lot to get into a hospital. I mean, you can just imagine how horrific that would have been. And so we took this unbelievable step to prevent it. Turns out the models were way off. We never came anywhere close. Now, in part, it was because of the draconian steps we took. And that's the great news. It's been weeks now since it's been clear that there's no danger of overrunning our hospitals. Frankly, anywhere in the Commonwealth, and very much in central Pennsylvania, this is not a risk. And so when the reason for the shutdown has passed, I think it's time to resume the opening. So I was disappointed when we just weren't getting a plan from the governor. So I put together my own plan with a lot of input from healthcare experts, epidemiologists, business folks, people from all walks of life in Pennsylvania and outside Pennsylvania. And let me just give you very briefly the summary of my thought process on this and how it differs from what the governor's advocated. The governor started off designating essential business. Then he has a process by which some business can get a waiver. We don't know really what that criteria is. Some do get the waiver, some don't. There is now a combination of objective and undisclosed subjective criteria for further opening up the counties. I don't think it should work this way. I think we should have much more transparency. And the criteria should be, do we have hospital capacity? Do we have either declining rates of transmissions or very low numbers of cases? And if we meet those two criteria, which frankly we do virtually everywhere in the state, then if business is able and willing to comply with the safety standards that are published by the CDC, and we know many of them are by heart, right? Physical space, mask wearing, hand washing, all of those kinds of criteria. To the extent that business is able and willing to keep their employees and their customers safe, then we ought to be able to get back to business, and people ought to be able to earn their livelihood. There's another really important point here, and that is one of the things we've learned is just how concentrated this disease is in one very small subset of our population, and that is people who are elderly and ill. In Lancaster County, 65% of all fatalities are actually inside nursing homes. So you think about that. Who are the people inside nursing homes? They are elderly people who are not healthy. That's why they're in the nursing home. That's a very vulnerable population, and we've got to do everything we can to protect those people. But that's also a very small subset of the population of Lancaster County, or for that matter, the Commonwealth. And by the way, that's pretty close to the statewide number. Statewide, it's 69% of all Pennsylvania COVID-19 fatalities have happened inside the walls of nursing homes. So I think it's abundantly clear, given the much, much lower peak, the fact that we're nowhere near threatening the capacity of our hospitals, that we understand who is really vulnerable and we can and should protect them, and we know how to keep the transmission rate slow by virtue of the CDC guidelines. For all those reasons, we really should be reopening, and Lancaster County certainly, I think, should be in the process. So with that, why don't I stop there, Congressman Smucker, and I'll kick this back to you, and we can take questions or proceed as you would like.
Thank you, Senator. And for those of you who have joined us, just to be sure everyone knows who's on the call, this is Senator Toomey, just finished speaking. I appreciate him joining us on this telephone town hall this evening. I am Congressman Lloyd Smucker. We will be getting to your questions just shortly, and if you do have a question or a comment, you can press 0 on your telephone. You can do that right now. That will connect you with a member of my staff, and we're going to get to as many questions and comments as we can. And when you have a question, the Senator and I potentially can both answer the question, or if you do have a question for someone specifically, you're welcome to address either one of us as well. So let's go to the first question. Let's go to the very first caller is James, and I can't see where you are from. James, are you there? James, are you there?
Hello, can you hear me?
Yes, hi, James. Where are you from, James?
Hi, how are you, sir?
I'm good.
Good. Well, Senator, I'm in Adamstown, and I just called in with a question.
Sure.
Before that, I do need to make a statement, sir, and I am upset that you politicize this conversation, which is supposed to be about facts. My query is quite simple. As a bed and breakfast in Lancaster that depends on tourism from outside of the county, primarily even the state, mostly New York, Maryland, and New Jersey, other hot spots, how are we helping ourselves by retarding our red phase and only opening to small industries that are dependent on the middle class of visitors like Lidditz and my Adamstown area?
So what you're asking whether you should be included in the yellow phase, or what specifically?
Oh, I know I shouldn't be, sir. I'm asking when I'm supposed to safely and coherently encourage guests from outside the area, especially in an elderly demographic, which is our primary demographic, to come here and spend hundreds of dollars on my rooms per night and spend thousands in the area, when I personally told my grandmother she's not to come visit.
Sure. Yeah, I mean, we know, and thank you for your question. I appreciate that. We know certain industries that are impacted far more than others. Tourism, hospitality, restaurants, hotels, really will see, not only are seeing a dramatic impact at the moment, losing in some cases all of their revenue, but it could extend for some period of time. We don't know how the public is going to respond, when they will feel confident traveling again. We do know when restaurants reopen, it will probably be, it surely will be ensuring that we can still do social distancing, so it'll probably be at some reduced capacity. So yes, I hear what you're saying. It's going to be a significant impact on a business like yours. We are looking at the numbers, and we should look at the data. And the data, we've learned a lot about this virus in the last 8 and 12 weeks. And what we've learned is that it is specifically targeting populations, the elderly, those with comorbidities, and these are the individuals who are impacted the most. So we also know the virus is going to be with us for some time, and so we can't just continue to stay closed the entire time the virus is with us. That would be absolutely devastating to every business owner. So we're going to need to figure out a way to open safely. I know when I speak to business owners, they're very concerned about their employees. They're already implementing practices and preparing to implement practices if they're not open now that will protect their employees, protect their customers. And I think any business that can do that should open now and can do that safely. And so, I do think we have learned a lot about this virus. Senator, any additional comments on that?
Yeah, no, I agree with what you're saying, Congressman Smucker. I would just add that I think if a business owner is not confident that he or she can keep his or her customers and employees safe, then they shouldn't reopen. Some hotels, some inns have been open throughout this entire period, including here in Washington. The apartment that I normally stay in was unavailable to me for a period of time, and we were in session. So I had to stay somewhere, and I stayed in a hotel. It was open. There wasn't a lot of people there, but I felt completely safe. They had taken some precautions that were not had not been there before, and I think that worked out fine. I'm not aware of hotels being a source of a big outbreak or any hot spots, but I would just strongly stress if anybody is not confident that they can keep their customers and employees safe, then that they shouldn't proceed to open.
Thank you, Senator. Let's go to Mary Ray from Felton. Are you there, Mary?
Yes, I am.
How are things in Felton? How are things in Felton?
Fine, thank you. I was just calling. I was wondering, my daughter works for a nonprofit, and she hasn't been able to file for unemployment. She's been out of work for 9 weeks, and she is beginning to struggle quite a bit. And I was wondering if there was any help for her whatsoever. I mean, they said you can apply for unemployment, but they keep sending her statements saying that she's not eligible. But I thought...
Mary Ray, I'll just say this. We're happy to talk with your daughter to see what is holding up that unemployment benefit that sounds like she should be accessing. I have members of my staff who are dedicated to doing that. So if you want to call into my office, or we have your number, we can call you as well. We're happy to connect with your daughter and see if we can help her. The fact that she works for a nonprofit should not affect her ability to get unemployment. So there probably is some other factor or reason that's been held up, but we're happy to dig into that and get her the benefit that she deserves.
Right. Well, I'm a senior citizen, and also I've been out of work now due to the fact that the doctor told me I should stay out until social distancing subsides. Mm-hmm. And I was just wondering if there is any type of a time frame for that period of this,
for what?
For the social distancing. How long do you feel that this will take place?
Well, Senator, I'll ask you to weigh in on that as well. But what I can tell you is that the virus will be with us until we, have therapeutic treatment, so some way to treat people who are sick from the virus. We do not currently have that other than keeping them comfortable and helping put them on a ventilator, keep them alive, and so on. But we have no treatment, no drugs specifically that cures the virus. We have some progress being made in that regard. And then secondly, we'll need a vaccine. And so I think until we have one or both of those things, there will be continued impact on our daily lives. And I think as we learn more about how it spreads, we can continue to respond to that. But I would expect there's going to be an impact for a while. Senator, any comment on that?
Well, just two brief things. It might be worth, after some period of time, checking back with your physician, because doctors are learning more about this disease just like everyone else. And as they learn more about the transmission, it might be that with certain precautions, the doctor might feel that it is safe to go back to work, and he might not. But it'd be worth checking on. And the other point I would make is, remdesivir really does show tremendous promise, and that's the medicine that is a therapy. It's not a vaccine, but it's a therapy, and it's not available generally right now. We have to. There's work to be done to make it broadly available, but that is underway, and I think in the coming months we're going to have some very effective therapy. There's lots of others in the works. That's one that has been demonstrated to be successful, and I think it's very, very promising. So still a little ways off, but the outlook I think is good.
We also have some promising developments in regards to a vaccine. There are multiple vaccines that are already in human clinical trials, and one vaccine recently was noted that it did create antibodies in individuals, and so it was just a very small sample size, but we're making progress in that regard as well. So it's good news. Let's go to Marilyn from Lancaster. Are you there, Marilyn?
York is doing that we're not doing, that their numbers are better.
I'm sorry, I think you were cut off a little bit in the beginning. Do you want to repeat that question?
Yes, I was wondering why the numbers in York are better than the numbers from Lancaster. What are they doing that we're not doing?
So that's a very good question, and I think both York and Lancaster counties have done a really great job. The leaders in both counties have done a great job in responding to the virus. And when I say that, they're working closely with the healthcare systems in the area, working with the nursing homes, ensuring that PPP is properly distributed to nursing homes and healthcare systems who need it. They are working on developing a contact tracing system. It goes on and on. They're both doing a great job. The difference in the two is that Lancaster County has a number of nursing home facilities, skilled care facilities, where the virus started and spread among residents. And some of these facilities are at one I was talking to recently is at 98 capacity. And one of the things we need to know, as soon as we know someone has the virus, they should be isolated and quarantined. And they were having even difficulty doing that when they're at 98% capacity. And in other cases, they weren't aware that the virus was spreading early enough. And so the difference is, and I think the center used a figure of 66%. There's a tally in Lancaster County, which is a little different than the states. That number is 75%, according to the coroner's numbers here, of the deaths in Lancaster County are in these nursing home facilities, and primarily 5 different facilities where this is spread. So that's the primary difference there. All right, let's go to Melody from Lancaster. Are you there?
Yes, I am. One of my questions was, please, for Lancaster County and also for PA, Pennsylvania, when will schools open, and also like businesses, restaurants, and so forth? When will we be, like, no offense, but back to normal and things like that?
Well, you're asking for Lancaster County or for Pennsylvania?
Lancaster County.
Sure. So in Lancaster County, we are still under the governor's red category, which is essentially a stay-at-home order, and only some businesses that he classifies as essential are able to operate. The next phase of his plan is to go to yellow, and he is using metrics and looking at what's happening in the county and has not yet decided when Lancaster will go to yellow. And then beyond that is green. One of the points I've been making with the governor is that the metrics are not the ones we should be looking at. We should be looking at hospital capacity. I mentioned earlier in this call that the surge that we expected never really occurred. Hospital capacity is less than 50% of our ICU beds are used up. So we should be opening now. But, unfortunately, there's one individual that decides that at this point, and that is the governor. Many elected officials in the area, including myself, said that we were going to move to the next phase and begin to open businesses because we just simply cannot afford to keep businesses closed down based on the metrics that the governor is using. The governor turned around and threatened to take licenses from businesses and other things. I think he is greatly underestimating the economic damage that is occurring right now. Every day I'm getting texts of businesses that are closing for good. And these are jobs that will be lost for good if we don't allow businesses to continue to start to operate safely. So stay tuned. I hope it is sooner rather than later. We should be opening businesses now that can safely operate. Senator, you want to jump in on that?
Yeah, well, you're exactly right. I mean, this is ultimately the governor's decision. I've been encouraging him to move along more quickly than he has been. We disagree about some of this criteria. I, for one, think certainly by September we really will be able to open our schools, and we really should. And I will tell you, I have a 10-year-old son, and I hope to be able to send him off to school in September. We've learned that children it's very, very unusual for children to be vulnerable to this if they don't have some underlying health issue that compromises their immune system or gives them other problems. So I think schools will want to take some precautions, and frankly, the bigger concern will be teachers and staff who are older, who are not as invulnerable as young children. But I do hope that by the time we get to September, I mean, the school year is basically over now anyway, but by the time we get to September, I hope that we'll be able to begin the new school year on time.
Senator, you had mentioned earlier that you're holding weekly roundtables with health and business leaders from across Pennsylvania. And I was pleased to be able to participate in one of those. Thank you for that. But we've been hearing from our medical leaders in regards to concerns they might have about reopening. And I wonder if you would be interested in sharing some of what you've heard from our medical leaders across the state.
Well, I have. I've spoken with folks from probably every one of the major hospital systems, many of the smaller county hospitals. And, the story has been really pretty much the same, with the exception of a few hospitals in Philadelphia that did have never got overwhelmed, never, but did have a significant volume of COVID patients. Everywhere else really was way, way below capacity. And the danger that they faced was their own solvency from being essentially closed down, but also the danger to the health of people who were no longer able to get elective procedures done. Now, that's changed to a large degree. Most Pennsylvania hospitals now are able to do elective procedures, but, it's really important because elective doesn't mean optional. We're not really talking about cosmetic surgery on the person's nose. What we're talking about are cancer screenings and a hip replacement and spine surgery, things where you might have some flexibility on exactly when you do it, but you better do it before too long or your health is going to deteriorate. And that was one of the things that the hospital stressed. The single biggest healthcare system in all of Pennsylvania is UPMC, and one of the top executives there really has felt strongly for some time now that the entire state should be reopening, and he testified to that during one of the roundtables I hosted. So nobody's talking about flipping a switch and going back to the way things were back in January, and the people of Pennsylvania wouldn't do that anyway. They understand that there are risks and people will take precautions, but it is time to move the process along.
Thank you. Let's go to Jeffrey Barnes from Mount Joy. Are you there?
Yes, sir, I am. I have a question and a comment. The question I'm going to put forth is this new stimulus plan that's about $3 trillion that Congress is putting through. This boils down to about $16,000 a taxpayer for the money. And the other thing is the fact from what I've heard about some of the things they're spending the money on should not be spent. And the other thing I want to make a comment about is I think that if we're moving toward opening things, we need to start opening our state parks so that some of us can get out and enjoy some recreation.
Yes, thank you for that. I thought the parks were open, so they're not?
There's a park over in Lebanon County that I want to go to, and you can go there, but none of the facilities are actually opened. You can't rent a rowboat and go out on the lake or do anything like that, or fish or like that. And the last thing I want to do is have somebody come up and arrest me, like they're arresting people for running on the beach in California.
Sure. Well, thank you. And we'll go to your first question. We just voted in the House on an additional additional stimulus package or aid package that really was in many ways a sort of Democrat wish list. Many items in the bill that weren't even necessarily related to the coronavirus crisis. And our position on that is, or at least my position is that, we really need to take some time to understand, first of all, to roll out all of the aid that was provided in the package that we had mentioned earlier in this call. Dollars to the state, for instance, is still not spent. Dollars to the counties is still not spent. They are working now to ensure that is done efficiently and addressing the impact of the virus. We need to see the impact on the economy over the next month or so. There may be a need for an additional package, additional aid, but I don't think we're at the point yet where we know whether that is the case. What I can tell you is that we cannot afford. There's not enough money to print to take care of all the issues that will arise if we don't begin to get this economy moving again. But the senator is really an expert in regards to fiscal issues, in regards to the debt. And so, Senator, if you want to respond, get your thoughts on that, that'd be great.
Yeah, sure. So I'd like to start with what we've done already because it's staggering what we've done already, right? We have already passed, and it's been signed into law, we've actually appropriated almost $3 trillion. Now, I'm going to confess, it's hard to wrap your brain around $1 billion. $1 trillion is 1,000 billions. So we've already passed that. But it goes beyond that because in that legislation we also authorized the Federal Reserve to lend an additional, call it $3 trillion. It's not a precise number, it could vary, but call it $3 trillion. So there's a total of $6 trillion that we have already fully authorized through a variety of programs to go out into the American economy. $6 trillion, another way to think about that number, that's about equal to 30%, almost one-third, of the entire annual economic output of the United States of America. That's what we've already done. Now, so far, only about 40% of that has actually been either lent or spent. So the majority of this gigantic number hasn't even gone out the door yet. It seems to me very imprudent to just decide we're going to spend several trillion more when It's not even possible to evaluate what we've already done because it hasn't reached its intended beneficiary yet. It will. It's starting to get there. It's moving along. But I really think it's not at all clear what, if anything, additionally needs to be done. And we really should wait and evaluate what we've already. It's all borrowed money, every dime of this. We don't have this money lying around anywhere. And, there's no free lunch. Somebody someday is going to have to pay this back. So I think really at this point we need to proceed quite cautiously.
All right, let's go to Mary from Christiana. Are you there?
Hello.
Hi, Mary.
Hello, can you hear me?
I can.
Okay, great.
Right.
I can. First of all, thank you, gentlemen, very much for doing this. My only hope is that I've gotten these phone calls at the last minute so many times, and it would be lovely if your office could, let us know ahead of time that you're doing this. But today I was able to make this one. And I was so glad because I am just so frustrated by everything, and I know I speak for a lot of people. And I have several questions, and I've been diligently trying to make them concise as I've been listening on speakerphone. So I'm just going to go for it.
Sure.
I agree with both of you gentlemen, how you said that the quarantine purpose was to keep the hospitals available, to protect the vulnerable, and flatten the curve, and we've achieved all those things. Mm-hmm. But Governor Wolf and Secretary Levine seem to be running the show in our state, yet have failed to explain and give the criteria for the waivers for reopening, while Mr. Levine and the Wolf actually put infected elderly into the vulnerable population. So why aren't we, and how do we, force the elected governor to do these things in addition to being more forceful in getting our state to reopen? I appreciate, Senator Toomey, the work you've done, and I know you used the word encouraging, and I'm sure those have been heated encouragements, I'm hoping at least. But I think we're way past encouragement at this point. People are desperate. I, myself, am not desperate, and I thank God for that. My husband and I are doing fine, but the majority of people, I'm sure, are really suffering. And this is really a frightening, horrible situation. So just the fact that these two have increased the deaths from this virus should be cause enough to be guilty of a gross negligence of duty on their part. Then there's the abuse of power by Mr. Levine for pulling his mother out of the nursing home. And then how do you differ this virus from AIDS, which targeted and killed a particular population group, but everyone wasn't punished to keep people safe? So it's kind of, there's a lot of things there, but that's where I'm at.
Thank you, Mary. I appreciate it. And I hear the frustration in your voice, and we hear that every day. People who are impacted, who are worried about the future, who are not sure whether their job will be available when they are ready to go back to work, or they're ready to go back to work now, but not sure when if they'll be able to go back. People who have poured their lives in the building of business are concerned about, and some are deciding that they just simply can't weather this anymore. So I hear the frustration, and I couldn't agree more. And unfortunately, I think we literally have a constitutional question here in regards to the power of the governor. The governor does have emergency powers, but how long should that last? And so I think we have some real serious questions that we need to answer here. How one individual can keep the economy shut down. It's amazing. So, but Senator, do you want to, she mentioned your name in that. Do you want to address that?
Look, I hear the frustration and concern in Mary's voice, and absolutely share it, and I've had variations of that kind of conversation so many times. I think we've got to try to persuade the governor. That's what, he's, at the moment, he's the one that is exercising this authority. I will say that the legislative body, the state house and the state senate, both seem to be interested in moving more quickly than the governor. Maybe not overwhelmingly, but I think there are outright majorities in both bodies that have a different view than the governor. Not necessarily enough to override the governor's veto on a particular piece of legislation, but we might get to that point. And look, as citizens, I think we all have the right to reach out to our elected representatives and try to encourage them to play a role in this. I mean, our state government consists of more than just the governor. There's a state house, there's a state senate, and we should try to engage them as well.
Thank you, Senator. Let's go to Wesley from East Petersburg. Are you there?
Yes, this is Helen Rainier. I just wanted to thank you guys. I appreciate what you're doing. And my question, there was a state, I don't know if it was Michigan or Wisconsin, they took it to the Supreme Court to be able to open. Is that something that's on the table?
Yeah, so that was Wisconsin. There was a decision by the Supreme Court in Wisconsin recently that declared the governor's stay-at-home order unconstitutional and essentially overturned it. Our Supreme Court in Pennsylvania had a different conclusion. There was a case that went to Pennsylvania, the Supreme Court, and they upheld the governor's authority to continue the lockdown. There was another case that was appealed to the federal Supreme Court, and they turned it down, saying it was a state issue. Whether there are still legal avenues that can be taken, I'm not sure. There are a number of cases in the works testing or questioning the governor's authority in this case, in this situation. But yes, that was Wisconsin. I think there will be other states, Supreme Courts, who will be looking at this as well, and it will be interesting to see what the outcome of those will be. Senator, any comments on that?
Well, very briefly, I completely agree with your characterization. I would say that in addition to other state Supreme Courts, I wonder if it's possible that other federal district courts somewhere in the country might take up the case. I don't know whether when the Supreme Court, the U.S. Supreme Court, refused to take this up, whether that precludes federal district courts all across the country from taking up cases that might have different circumstances. So there's a possibility that some aspect of this exercise of authority still gets litigated in the federal court system. That would be my only additional point.
Yeah, I hope so. Don't you think there's a real constitutional question here in terms of the sort of extent of the governor's power in an emergency situation?
Yeah, I think there is, right? Clearly we have constitutional rights, the freedom of assembly, for instance, which is basically suspended. You could argue that the freedom to exercise our faith is dramatically curbed if you can't assemble at a church. Now, under some circumstances, like national emergencies, I think there's an acknowledgement that governors have that authority, but there have to be limits, right? There has to be some kind of balance. A governor couldn't just frivolously decide he's going to suspend a constitutional right. And so we might very well end up with a case that would test those limits in the court system, but I couldn't point to a particular one at this point.
Thank you. Let's go to Mary from Elizabethtown. Are you there?
Yes, I'm here.
Hi,
Some
Mary.
of us think, hi. Some of us didn't get a stimulus check yet. What's going on? I hear of all these people got their checks, and some of us didn't. What's going on? Did you run out of money?
Well, no. Senator, do you have an update on that? I'm happy to answer as well, unless you have more information than perhaps I do on that.
No, Mary, we'd be happy to try to help you if you want to call my office. I think a big majority of the checks have gone out, but in some cases, people who file through physical paper filing and either make their payment or get their refund by a paper check. I know there are cases where people are still waiting, but we didn't run out of money except in the very broadest sense. So your check should be on the way, and we'd be happy to try to help you track that down. If you'd want to call my office, we could do that.
Likewise, you could call either of our offices, and we'd be happy to help. I can tell you that checks. This was a massive undertaking to have a check written or direct deposit to every citizen, essentially, who had it was eligible for that, and so it in one way it's a factor of time. The initial wave that went into direct deposits and then checks going out, so they are still going out. So hopefully you'll be getting here soon.
But just Mary, let me give you a phone number you could call. This is my office number in Washington. And we could have someone try to help you track this down. If you have a pen handy?
Yes, I do.
Okay, the number is 202-224-4254.
Okay. And I have another. I just want to tell you now. We live near a walking trail, and one Saturday, this was about 3 weeks ago, all those cars that were on the walking trail in the parking lot were from New York. Why don't people stay home so they don't spread this more than it is? That made me...
Thank you, Mary, because we live in a beautiful area, and they love visiting here.
I know,
but thank you. Thank you. I really appreciate you being part of the call. Being outside is perhaps the safest way to interact with others in terms of the potential to get the virus. And so, we do have a lot of great trails around our area, and I can understand why people would be interested in getting out. I think we have time for perhaps one more question. Let's go to Ken from Lancaster. Are you there? Ken Eckert.
Yes, sir. I'm here. How are you?
I'm doing all right. How are you?
Doing well, thank you. As I said, I'm from Millersville. I'm actually the president of the Millersville Lions Club pool here in Millersville. We run a nonprofit pool.
Yeah.
Well, thank you. And we're one of the only pools to not announce that we're closing. So far this summer, we've had almost every pool in the county, in Lancaster County here, shut down so far. And it has left, obviously, some impacts on the summer sports, swimming, things like that, swimming lessons for kids. And we continue to be hopeful that we can open. I mean, we have a pool that has 250,000 gallons of water and over 17,000 square feet of fenced-in grass area. According to the current guidelines, we cannot open until green, and we're obviously concerned about our state license for the pool. We've kind of gotten the runaround as far as what we will be required to do, but like you just said, some of the best activities are outside. It's been shown that UV kills this, chlorine kills it. There's been no communicable cases as far as waterborne transmission.
Sure.
And I got to tell you, I run our social media and everything, and the outreach from our community to open this pool. I mean, at what point is the government not going to be okay with people just having to do their own thing because they're willing to take the risk? As some people see it and other people don't see it as a risk.
Sure. I mean, at some point, we will be relying on individuals to recognize the risk that they will be taking in the decisions they will be making in regards to how they want to interact with others, because we will need to reopen the economy and the virus will still be here. And what it will mean is that those who are most at risk, we know now who that is, will need to take extra care beyond what others who have less risk will do. Unfortunately, at this point, the governor is making the decisions in regards to what can open and cannot. We are seeing a gradual loosening of some of the regulations that he has put in place. For instance, golf courses were allowed to be open. Construction was open. I think those were both good decisions. I would say just continue to make your case, continue to petition to the governor's office, and we'll just have to see how that rolls out. I'm not sure. Senator, any thoughts on that?
No, look, I'm very sympathetic to this. The combination of being outdoors, high temperatures, and chlorine, that's not a good mix for the virus. And so I think the risk of transmission is likely to be extremely low. What we could do, Ken, is see if we could find any research that would back up from an epidemiological or medical point of view, and happy to pass that on to you. If you haven't been able to find that, my staff can probably find some information, and then submit it to the governor and hope that maybe it would change the way he thinks about this.
That's a great idea. Well, we are at the end of our hour. I'd like to thank everyone for joining us. Really special thank you to Senator Toomey for taking time to join us this evening. Senator Toomey, any final words?
No, the only thing I would say, first of all, thanks for inviting me to do this, Congressman Smucker. I've enjoyed working with you since your first days in the House, so I appreciate that. I would also just stress, every single day, our ability to defeat this virus improves. We understand more about it. We have more testing capability. We're gearing up our PPE every single day. We're making progress on therapies. We're making progress on vaccines. And we just understand the mechanism, the transmission mechanism, the way the virus works, what it attacks, who's vulnerable. Every day, our scientists and medical professionals know more about it than they did the day before. And you never lose that knowledge. It just continues to grow. So I'm very confident that we're just going to be in a better and better place as time passes. And so I hope people will have an optimistic view about the future. And I think even in the near term, we're going to be able to go a very long way towards getting back to normal. And before, maybe surprisingly soon, this will be a thing of the past. So I get to have a lot of conversations with some really terrific and capable people who are making real good progress on a variety of fronts. As frustrating as the situation is today, I do want to encourage everyone that this is going to get a whole lot better, and maybe sooner than a lot of people think.
Well, thank you, Senator. That's a great positive note to end on. I really, really appreciate you being with us this evening. I very much appreciate your leadership in the Senate. We are very, very fortunate to have you representing Pennsylvania in the U.S. Senate. I know that you are certainly a leader there on many different issues. So it's an honor to have you with us this evening. Sorry I didn't get to all the questions. If you are still on the line and you had a question, you can press 1 to leave a voicemail, and then we'll get back with you. So if you have a specific question you'd like answered or have a comment, or if we can be helpful in any way, just press 1 as soon as we leave. You can also visit my website at smucker.house.gov for information on the coronavirus or any other information for that matter in regards to the federal government. Again, that's smucker.house.gov. Thank you for participating. Have a great night. Bye now.